Anyway, good morning, everybody. My name is Philip Waite, and just a quick introduction. Let's go back. Just a quick introduction. Liaison Workforce offer proven workforce management systems and advisory services that not only generate sufficient savings, but deliver strategic insights and operational values. Liaison OneCall, the part of the organisation that I work for, is part of Liaison Workforce, and we exclusively offer staff benefits for NHS trusts and health boards, with the objective of aiding staff well-being and generating primary and secondary SIP savings. The OneCall management team have been involved in staff benefits for over 20 years, and they were actually responsible for launching the first home technology benefit in 1999. I always find this statistic amazing, and without doubt, it demonstrates the importance of an employer offering and promoting, and that is key, promoting the right staff benefits to their staff. The fact that 78% of employees reported they're more likely to stay with an employer because of their benefits program.
Philip, can I just interrupt for a moment? I'm not seeing a slide transition here. So we've still got, there we go. Now we can see it. Yeah, there we are. That's working.
Okay, I'll do it that way rather than through the slide progression. Okay.
Good.
So
okay.
As I say, that's the key statistic I always think that employers should be aware of. The benefits any organisation offers to their staff affect 4 key areas for their organisation. Recruitment, to make your trust the most attractive local trust to work in. Engagement, ensuring all staff are engaged with the trust with everything that they offer. Well-being, absolutely key at the moment, obviously, to make sure all staff have access to multiple resources to ensure their mental, physical, and financial well-being. Retention, something all the trusts that we work with have identified to be an issue, and I'll later prove how staff benefits can actually aid this. And this is where I want to really focus. The provision of a wide selection of staff benefits is often not acknowledged as a way of retaining staff, and certainly there is no recognition that staff SIP savings can be generated from staff retention, secondary rather than primary SIP savings initially, or as a benefit of retention. Organisation reward is a strong element of an overall retention strategy. If employees actually understand the benefits available to them, they will place a higher value on their overall reward package, and this will actually help them come to informed decisions if they ever consider leaving an organisation. The types of staff benefits that need to be considered to maximise staff recruitment and retention are principally these, and I've broken them down. Health and well-being. Now, many trusts, but not all trusts, which surprised me, actually have an employee assistance programs in place. Some have self-service resources, 24/7 counselling, but the EAP program is a key part of one of the benefits any trust can offer. Online resources, again, around health and well-being, maybe their website links, podcasts, videos, mobile apps, really anything that is almost a self-service rather than accessing the 24/7 phone counselling. Discount vouchers. Almost everybody is aware of national schemes, but there are also local discounts, and I'll go into that in more details in a moment. Salary sacrifice. There are a number of different salary sacrifice schemes available. Home technology, lease cars, family holidays, cycle to work, and on-site nurseries. Many people were led to believe that when HMRC implemented OPRA, the optional remuneration arrangement from April 2017, that was the end of salary sacrifice. Yes, it brought in some new rules to make salary sacrifice programs compliant, but in fact, quite the opposite to stopping it. It opened up additional opportunities. As demonstrated by the fact that this summer, we got HMRC approval to run a family holiday salary sacrifice benefit for staff. Maybe not great timing, but I hope by early next year, everybody's going to want to go away and actually be able to get away. Just going back to what other benefits are available. Salary deductions, again, lease cars. Some staff can't actually benefit from having a salary sacrifice for lease cars because they maybe go below national living wage, but that can be provided through a salary deduction. Gym membership, financial well-being, again, are salary deductions opportunities. And then there are other benefits such as trading your annual leave, travel discounts, railway railway subsidies, and staff lottery.
Phil, could you just very quickly just give a little bit more amplification to the financial well-being element?
Absolutely. This is actually provided by, there are a number of providers that are out there, although one's just been taken over, Neighbour has just been taken over by Salary Finance. And it's an ability, they offer an ability for people to be able to either maybe if they're being paid on a monthly basis to actually take a loan out on a weekly basis, or to have a savings integrated into their salary as well. So it's both the ability to borrow and the ability to be able to save at the same time.
Thank you.
No problem.
If anybody has questions, by the way, do please load them up via the chat functionality, and we'll go to those when Philip's finished.
Because benefits have grown up, the benefits offered to staff have normally grown up organically. There's often no centralization within a trust as to where staff benefits are offered from, which results in different groups from actually being responsible for different benefits. It also means that staff are directed to different places to access the benefits. So maybe through a external website for a cycle to work scheme, or it could be via internal intranet links. It means that there's no coordinated place single spot where people can actually go to and see what is available to everybody within the trust. For example, occupational health and HR managers may be responsible for running the trust's, not running, but actually organising the trust's EAP programme. HR or even finance may be responsible for running salary sacrifice programs. We work with some trusts where some salary sacrifice programs sit and are managed by the finance department, some are managed by payroll, some are managed by HR. So there's disparate areas within the trust that are actually organising the benefits for the employees. Just talking an example about that is the national the discount vouchers. The national discount voucher programs such as Blue Badge or health discounts are offered by external organisations, and staff just sign up and use them. There's no one actually responsible within the trust of actually promoting those programs. And you might wonder, why is it actually a benefit? But if you think about it, it's a very powerful way of engaging staff. Everybody is looking for savings, particularly at this time. And two areas which trusts really don't understand this can help is, for example, for new joiners and for bank staff, who are often not able to access other benefits as they're only available to substantive staff. But discounts, national and local, can be made available, and it can engage with new joiners and bank staff. Talking about local discounts, a few trusts do gather together local discounts, but have no proper way of sharing them amongst staff when they need them. For example, when they're out shopping, there's no point having a list of the discounts that are available stuck up outside the canteen, which we have seen before now, 4 A4 sheets stuck outside the canteen. But of course, if you're outside Costa and you want to get a discount, there's no way you can do it. So it's important that they are available on the internet and also through an app. So being able to access them through mobile devices easily when they're outside. So in summary, basically, a benefits portal is important to bring everything together for the employees of the trust, irrelevant of who is providing the benefit, as no trust should be made to use a single supplier. In addition, it's important that trusts can customize their portal to reflect how and what they want to deliver. And that's really an area which we think is very, very important. And what I'd like to do now is to show you exactly what I mean when I talk about a centralized staff benefits portal. We've created a couple recently for South Central Ambulance and Lancashire Teaching Hospital. So what I'm going to try now is actually go online and show you a couple of examples, if that's all right. So fingers crossed we actually get there.
I was going to say, this is the fingers crossed moment, Phil. You're doing great here. You're doing great. I've got every faith.
Can you see that? I might have to. Can you see that?
No. Have you gone to a separate screen on your?
Yeah. What
PC?
I'll do is I will stop sharing and I'll come back on and share again.
Yeah. Share the other screen. Quite. Yeah.
Right. Can you see that?
We can.
Excellent. So this is Lancashire Teaching's staff benefits portal. And again, it brings everything together. Whoever the supplier is, it brings everything together in one place, which is very, very important. So for example, their EAP provider is Health Assured. It just links through to Health Assured, logged in, they can access all of their information in one place. If you're looking, for example, at salary sacrifice, you can click through to salary sacrifice. And again, you can see all of their benefits that they're actually running: technology, mobile phones, white goods, leased cars, cycle to work, parking, on-site nursery. And it doesn't matter who's providing them. As you can see here, there are different people providing these benefits. So you've got Fleet Solutions, we provide the top three, parking is done in-house, and Busy Bees is obviously the in-house nursery. So again, it just demonstrates that they are all different providers, but it brings everything into one place. And what's important about that is that, you know, if you're sending people off to different areas, they may not realize that you're actually running a phone scheme or you've got an in-house nursery. So by bringing it to one place, they can actually see it all together. Also then looking at some of the resources they've got. So for example, in the wellbeing side, these are some resources that we've actually put together. And this is where, rather than the EAP, where it might be a telephone counselling service, this is actually bringing together resources that could be on a self-service basis. And let's say, for example, your anxiety, stress, relaxation techniques, sleeping well, just click through to the resources. And you've got lots of different resources there, whether it's websites, mobile apps, podcasts, different documents you can download, even down to videos that might be useful in different areas. And as I say, this is a self-service area, because a lot of people don't necessarily want to make the call to a full counselling service at this point. They just need to have a few resources to access. But the key is the benefits, as I said earlier on, the benefits portal actually should be looking and reflecting each trust as they want to do it. So for example, now if we look at the South Central Ambulance one, can you see that still?
Yes.
Excellent. So if you look at the South Central Ambulance one, this is completely different. It's exactly the same concept. We put together all of their different bits of information they want to bring in, or the different benefits into one place. So for example, if we look at their staff benefits, they've only got three. They've got the home technology, the cycle scheme, and the car leasing. But it brings it all together in one place. They wanted to particularly have their own well-being and support areas. So they've got their own different resources that they wanted to bring onto the website. It's got to be whatever any trust wants, but the important thing is you bring everything in together. Right, I'm just going to go back now to the PowerPoint. So I'm just got to disconnect again and share screen. Nope. Well, that's interesting. Where's it gone? Talk amongst yourselves for a moment.
It's all right, Phil. All of our fingers are still crossed for you. Just while you're finding that, perhaps you can do two jobs at once. I'm not sure, but could you just highlight how one brings together all of those different services? Is that a service that Liaison provides as part of your software, or is it something that you leave up to the individual trusts to create?
No, it's something we actually do provide. It's obviously there are other providers out there, but like advertising, you can't do it like the BBC, but it is something which we think is very, very important. And there are key things to bring together on that. It's you've got to allow the trust to bring in whatever resources they want to bring in. It shouldn't just be, well, you've got to provide everything. We've got to provide everything. So for some reason, it's not allowing my screen to share.
Pip, any thoughts? Sorry, it's not Pip, is it? Jenny, any thoughts?
That's all right.
Rachel, any thoughts?
Sorry, there's lots of rooms. I'm just going to not make you host. I'm going to remove you, put you back on, and just see if that does anything. So just bear with me a second. Like turning computer on and off.
Just reboot it.
Yeah.
Tech 101.
Okay, that's done now, Phil, if you want to give it another try.
Post to disable screen sharing.
And now? All good?
No, your browser does not allow it. Anyway, don't worry, I'll carry on. Not a problem, don't worry.
Talk to us, Phil. You're doing a great job here. Just talk to us. Tell us how it works.
Absolutely no problem. So every trust is facing an ongoing challenge to retain staff. It's putting its staff provision under constant pressure and increasing spend on temporary and agency staff. And what I wanted to do was actually demonstrate, we've got 2 case studies, which will be a bit tough to do without seeing the numbers, but I will carry on anyway. 2 case studies that show how running staff benefit schemes demonstrably help in staff retention. And actually, as I said before, allows in generating secondary SIP savings because of the savings. So we did a case study for both King's and South Central Ambulance. And in these cases, we were looking at the salary sacrifice benefits they were running, in particular, home technology, cycle to work, and lease cars, although for King's, lease cars was not relevant because they weren't running it at the time. And what we did is we head count of the trust, and we looked at the head count that had not participated in that year's salary sacrifice, and we looked at the ones that had participated in the salary sacrifice. Of the ones that had not participated, for King's, 16.5% of staff left. For the ones that had participated, only 10.1% had left. So now that's a big number. So 6% of all the staff, which equated to 74 members of staff, could actually be classified as staying because of staff benefits. Now, that's not exactly true. We can't necessarily say that because it's not an exact science, as obviously there may be other reasons for staying. But having run the numbers on a few trusts, all of which demonstrate greater retention for those who have participated in staff benefits. Maybe it's the benefits, maybe it's because they're more engaged with the trust and everything. But what it does show is that if you've got staff engaged and if you've got staff actually participating in the benefits, they're more likely to stay. Now we estimate, and with the help of the trust, we estimate that the costs of actually employing a member of staff is about £5,000. So that includes recruitment costs, bank costs to cover, time costs to recruit, to interview, onboarding, training, integration, etc. Approximately £5,000. For 74 people in a year, that's equivalent to a saving of £370,000. And forget anything about the sort of the disorganization about bringing on new members of staff. If you've got staff there, they know everything, they know how it works. So apart from just the financial savings, there's a lot of other savings and benefits as well. When we looked at South Central Ambulance, the numbers were even greater, although a smaller trust. We actually only had 2.7% of staff leave that had a benefit. Now that resulted, as I say, because it's a smaller trust, it related to 19 members of staff but that's still £100,000 worth of savings. It's a lot of benefits coming from increasing the retention through staff benefits.
I think it's fair to say, Phil, if you don't mind me just interjecting for a moment, because I think this is such an important aspect here. What you're suggesting is this isn't just a nice to have, but actually in hard financial terms and in terms of employee retention, we should be crawling naked over broken glass to find a way to do this, because it has, you know, demonstrable quantitative measurements of benefit for us.
Absolutely, for every trust it does. So bring it all together, offer as many benefits as you can, bring it all together in one place, let more people access it, and you will get greater retention. Added to which it will help on the recruitment side as well. If your nearby trust is not doing it, you can actually bring in staff as well. So it's all about well-being, retention, recruitment, and engagement. Absolutely fundamental.
And Phil, could I ask a supplementary question? If you are an HR or OD employee in a particular trust and you're looking to get something set up on a more formal basis, such as the examples that you've already used, are there say 3 key things that you really must have that in your experience really do boost the perception of value in the benefit? So there are three things that really stand out?
I think, yes, there are. I mean, I think probably the number one is offer as wide a selection of benefits as you can. Simply because you're going to get more engagement from different people, different things interest different people. So as wide a selection of benefits as you can is number one. Number two, I think, without doubt at the moment in the current situation, make sure you've got an EAP scheme in place. You've got to be able to support your staff for health and well-being. So that is definitely number two. And number three, make sure that you bring everything together in one place that is accessible over the internet and on an app or on a mobile, so that it can be accessed at home or it can be accessed out on the road or in the canteen. You don't have to be in front of a computer to access it.
Can we just a bit of fun, really, but let's just see. We've got an audience of about 30 at the moment. So could you all just use the chat quickly? If you've got an EAP system set up, and Phil, just remind everybody, EAP, the acronym?
Employee, never really remember it myself, actually. Basically, it's an employee, what is it?
Sorry to put you on the spot
You've
here.
put me on the spot there, haven't you?
Assistance program.
That's exactly right. Thank you.
Just use chat, everybody, now. If you've got one, we've got 30 people on the call. If you've got one, just say yes. And let's just see how many people we get here. 1, 2, 3, 4. We've got a poor one from Margie. 5. Any more for any more? I'm only showing 5 so far.
Yeah.
Think so, says Adi. That's as good as no. 7. Unless, no, Graham's, I'm double counting Graham there. He's put it twice. He's so enthusiastic about his. Well, let's call it 7. Let's call it 7, Phil. It looks to me, if people are actually interacting here properly, out of 30 people, take you and I out of it, 7 out of 28, basically. Yeah. You know, 25% have got an employee assistance program going, which is, I think that's instructive. Margie, are you there? Can you hear us? Margie, could you just unmute? I'm very keen, if you wouldn't mind. You say that you're a CCG, and yes, you do. There's a recent user, it was quite poor. Could you give an idea of why you felt it was quite poor? And maybe Philip can content. Audio not working, says Margie. All right, don't worry, don't worry. Phil, back to you. Apparently your screen share should be working now, I'm told.
Okay, no problem at all. Let's just try it one more time. No, don't worry. I've got used to not having it. Not a problem at all.
It's better without, to tell you the truth. You're a far more engaging speaker without it, if you don't mind me saying so.
Anyway, with regards to EAP, we don't provide an EAP ourselves. What we do is we work with we think who are the market leaders, which is Health Assured, and it's important. I mean, we don't try and do everything. We bring in the best people we can work with into what we offer. But really, just to summarise, then, every trust should be maximising their staff benefits on offer. I mean, what I've not even mentioned is on the primary SIP savings that a trust can generate from actually running staff benefits as well. On the salary sacrifice, where the trust can actually be making, well, as of next year, 20.68% savings from pension contributions. So it's a massive number that they can make. Not only are you helping staff because they're being able to access what they want to access when they want to be able to get it, but the trust is actually making a saving as well. So there's lots to be said to maximising your staff benefits. But in principle, I think there are 4 key areas which I've touched upon at the beginning, which is 1, it aids recruitment. If you are the trust with the best local and the greatest range of benefits on offer, it's just another tick in the box. And I do know there was a Kent trust that we went to see once, and they said, we're losing staff because our next door trust has got multiple benefits that we don't have. So it really is worth doing. It increases staff engagement. It allows people to be able to engage with what the trust is offering, both internal and external suppliers. So maybe if you've got an occupational health team that's got lots of content they want to distribute around, again, if you put it into the portal, then you've got everything in one place. It helps the staff well-being. With multiple resources, an EAP program, the self-service resource, you can even see, if you've got a portal, you can then see which areas people are accessing. So, for example, if you're suddenly finding everybody is accessing the stress area, you know that you've got an issue within your staff about stress. And you can then start to actually begin to think, right, how can we get the message out there to aid and support them? So again, very, very important. And as I've talked about already, obviously staff retention. I think we've proven that more engaged staff take up the benefits, they're less likely to leave. And the final thing really is...
Could I ask about social care, Phil? Would you mind, so can you make this available, or is it available in local government, local authority, community health, that kind of stuff?
We principally work with trusts and Welsh Health Boards. You can do it also for local authorities, yes. Not so much, I mean, possibly we could do CCGs as well, but it's principally the trusts rather than the CCGs.
Okay. I mean, I just know that we're going to get a lot of people saying, I work in local government, social care, CCGs, community health, that kind of stuff. And they're going to say, we would love something like this. So that might be something for you good people at Liaison to give some thought to. What about questions now? Do please, if you've got questions for Phil, do please use the chat facility to do that. As I say, you can see how enthusiastic Phil is about it. You can see some of the successes that Liaison have helped to contribute towards. Any questions at all, do please put them in the chat. And I know Phil will be perfectly happy to answer them. We just wait a moment for those to come through, Phil.
So there's just one last quote, which I do always like to end on, is according to recent research on employee retention, happy employees stay twice as long in their jobs as their least happy colleagues.
There you go. You heard it here first.
John, can I ask a question?
Please do, Roy.
Hi, I think that was a really interesting presentation, and thank you for it. My question is, I mean, at the moment, everybody is kind of completely preoccupied with COVID for very good reasons. And But of course, at the same time, we're trying to do business as usual. I interviewed Simon Stevens this morning, and he was at pains to say, you know, we're trying to do business as usual. I didn't quite put it as bluntly as that, but that was the message. And of course, we're now in the middle of a fundamental reorganization, actually. You know, we're going from the chaos of the Lansley reforms to try and claw back some shape of a sort of a regional health authority, which is, you know, what SDPs are, and then we've got the integrated care organizations, which are what district health authorities were, where they're managing the local health pound, and that's quite a lot of turmoil, isn't it, for the staff to cope with. I mean, I know the focus is on the front line of healthcare, and rightly so, but there are a lot of people that come to work in a collar and tie, don't stand next to a bed, they sit behind a desk, but they're making just as much of a contribution. And I thought that the changes that they will be going through, and it's a big upheaval. It's about really how leadership addresses those changes, how management addresses those changes, how, you know, are we saying, don't worry, there's jobs for everybody, or are we going to go through this ludicrous thing of having to reapply for your job, which is so dispiriting and demotivating? I just thought, you know, watching you speak so eloquently about, you know, what you just done and the workforce, I just thought you might like to say a couple of words about managing through that process.
Yeah, so certainly, Roy. Thank you. I mean, I think you're absolutely right. I think changes are often good, but not necessarily good for the members of staff, and they feel they're sort of not being listened to, and they're not being sort of being part of that process. So again, I think just turning it around on benefits. I think that, you know, if you've got an engaged staff where there's lots of different areas and lots of different things that you can provide for them and help them with, and information, and remembering that they've got a family behind them as well. So maybe that holiday is actually of real importance to them. I think that helping them through this terrible time at the moment and the stress that's actually being built up with them is very, very important. In fact, it's critical. And although you're right in saying that, you know, things have got to go on away from COVID, and I agree with that. But now is the time actually you need to be making sure your staff are okay, and they have everything they need. So I think things like benefits are fundamental. Even now, if trusts have not got them all integrated and working well and getting the message out there, they need to be doing that.
Yeah, I think it's a really important point. John, thank you very much for letting me ask that question.
No, it's a pleasure, Roy. Thank you for coming in. Phil, I've just got Margie, who's on the chat, has said that she thinks the STP partnership she'll put will bring in local authority and social care colleagues together in a space. But I guess the key is, well, yeah, but somebody's still got to have the foresight and the control to then bring all of that information together in a single site, as you've advocated, to make sure that people can access it easily and understand the fundamental value of it.
Absolutely, and the difficulty with an STP is, of course, that at the moment, from what I understand, they're still separate employers. So that you're going to have, if you've got a salary sacrifice, you've got to bring all of the different employers in the STP together. I mean, we're working with a number of trusts which have merged recently, and just trying to get a single platform for 3 trusts that have merged together to work and get everybody in senior management engaged on that can be challenging in its own right. Trying to get local authorities within an STP and the trusts and the primary care makes it even harder, but it's definitely got to be a goal to have.
Have you successfully managed to engineer a solution in that regard yet?
Yes.
You still bear the psychological scars, Phil, I can say. Well, look, if any of you watching this would be interested in contacting Phil to find out if there's some solutions where you work, or you want to just call upon his expertise to give you a little bit of guidance, Phil, how do they contact you? Shout out your email.
I'll pop it in the chat room.
Yeah, just forgive me, but we're recording this as well, so shout it out. You know,
no problem at all. It's Philip with 1 L at the number 1 call CALL benefits.com.
Philip
at and then the number 1 call benefits.com.
Philip at number 1 callbenefits.com. There you go. You heard it here first. Phil, I've got to say, that is a fantastic presentation, full of really interesting content. We are most grateful to you for taking time out of your busy day to deliver it.
Problem.
And actually, once the PowerPoint went away, I thought it was even better after that.
So no death by PowerPoint in future.
No death by PowerPoint in future. And your use of the live link